Hi, and welcome back to the Elder Watch series, Long-Term Care Planning. Today we'll be getting into part 2 of this chapter in this series, which is called, Does Insurance Cover It? Let's get started. Elder Watch is a 20-plus year collaboration between AARP and the Colorado Attorney General's Office. Our mission is to fight the fraud and financial exploitation of Coloradans 50-plus through education and outreach, data collection, as well as our fraud victim support helpline, which is volunteer-led. If you or someone you know may be the victim of a fraud or a scam, or you tried to order a pack of keto gummies and now you're getting hundreds of packs of keto gummies and you keep seeing the recurring charge, but now you can't get in contact with the person you bought them from, that's a scam we get a lot, by the way. Give us a phone call. Our phone number is 800-222-4444, select option 2. My name is Jessica Zawadsky, and I am the program specialist for Elder Watch Colorado. In this series on long-term care planning, we're covering 4 topics that are very important when it comes to understanding long-term care options, as well as building a plan for you and your loved one who is considering long-term care. So first, we talked about options and acronyms, where we went over some of the different types of long-term care facilities that you might see, that you might consider. And then we also talked about some of the jargon, those acronyms, that alphabet soup that you might encounter on your long-term care planning journey. After that, we talked about some of the considerations and questions that you might want to keep in mind while you are either trying to decide on a level of care or when you're trying to compare one facility to another. So that was considerations and questions. Today, we're finishing up the third topic, which is, does insurance cover it? And then the last topic, topic 4 that we'll cover, is some ideas, some strategies on how to pay for things that insurance doesn't cover. So for this series, Does Insurance Cover It? Really, I'm talking about Medicare and Medicaid, which are both health insurance programs. Medicare is health insurance for individuals who are 65 plus or who have a qualifying disability, whereas Medicaid is for individuals, families, and children who meet certain income requirements. So to be eligible for Medicare, you must demonstrate generally your age, and to be eligible for Medicaid, you must demonstrate income under a certain amount. So today we'll be talking about the bottom half of that little diagram that I made. We'll be talking about higher level of assistance options in terms of both short and long-term care options and how Medicare and Medicaid might help you afford them. Now, throughout this presentation, I'll be saying that coverage is likely or unlikely for a lot of reasons, one of which is that everyone's situation is different. And so certain aspects of care in one situation might be covered, whereas certain aspects of care in another situation might not be covered. And these policies also are subject to change. By the time you watch this video, things might be a little bit different. So take what I'm saying as kind of more generalities. I am not offering financial or legal advice. I do not work for Medicare or Medicaid. I'm making this presentation because I think this is a really complicated topic. And so I want to give some ideas about where Medicaid or Medicare might help you out, but making sure that you understand and inspect and talk about your specific situation is critical when it comes to long-term care planning and insurance coverage of it. So custodial care is a phrase that you'll definitely be hearing in this presentation. And I mentioned it in part 1 of Does Insurance Cover It? But it kind of applies even more to part 2 because we're talking about higher level of care options. So custodial care is understood as non-skilled personal care that helps people with chronic illness or disabilities with activities of daily living, or ADLs. So when we say ADLs, we're talking about things like using the bathroom by yourself, eating by yourself, that type of thing. Now, custodial care, if you need it, is generally an ongoing need, and it's often a huge piece of why an individual is considering long-term care in the first place. But unfortunately, this also often incurs a room and board expense that might not be considered medically necessary. So if it's not considered medically necessary, you might have to pay for it out of pocket depending on which insurance coverage that you are looking at. So when it comes to custodial care, because it's not considered medically necessary, it's not usually something that Medicare will pay for long term, though Medicare might help you offset some of the costs associated with custodial care. On the other hand, Medicaid is more likely to cover a chunk, if not all, of your custodial care, so long as it's provided in a Medicaid approved facility or one that has a Medicaid contract. So again, it's very, very important, if I haven't said it enough already, to discuss and understand your particular situation. But custodial care also illustrates one of the reasons that people will try to do a spend down to help afford their long-term care. If you don't know what a spend down is, go back to part 1 of this web series. It's a very important piece of long-term care planning and financing it. All right, so now that we've gotten some generalities, some definitions out of the way, let's start by talking about how Medicare and Medicaid pay for or don't pay for short-term, higher level of assistance, long-term care options. So as the screenshot on the screen says, acute care hospitals are facilities where individuals receive treatment for brief but severe episodes of illness. Now, when it comes to Medicare and Medicaid, Medicare is likely to pay for your stay in an acute care hospital so long as it is inpatient. So again, it's very important to check coverage for your specific situation to understand what inpatient means and what that qualifying stay entails. Medicaid is also likely to pay for your stay in an acute care hospital, but again, it's important to double check for your specific case. When it comes to an acute rehab hospital, again, so long as it's inpatient, it is likely that Medicare will cover at least parts of your care. But again, it's important to understand your coverage and any limitations that go with your specific case. It is also likely that Medicaid will cover this stay, but again, just make sure that you double check to make sure that your specific stay qualifies for that coverage by Medicaid or Medicare. All right, so next we're going to talk about hospice and palliative care, which are terms that are often used interchangeably, but they're not the same thing. So if you want to understand more about the differences, go back to options and acronyms. But briefly, hospice is non-curative care for an individual with a prognosis of 6 months or less to live. Now, if you choose a Medicare-approved hospice program, emphasis on the word approved, it is likely that Medicare will cover all costs related to pain relief and symptom management. However, it is important to understand whether room and board are covered as well, because they may be, they may not be, and they can be a significant portion of the cost of hospice. Similarly, Medicaid is likely to cover a hospice stay and may also cover room and board, but it's important to understand your specific situation, that specific facility, whether it has that Medicaid contract. Like hospice, palliative care is non-curative. It's not trying to cure whatever is happening. It's trying to alleviate some of the symptoms that you are experiencing related to that illness. And not just medically, palliative care will also often give supports through an interdisciplinary team for things like your mental health and the support of your family caregivers around your condition. Now, Medicaid is likely to cover palliative care, but again, it's important to understand whether room and board will be part of that coverage and to understand how Medicaid will work for you specifically. When it comes to Medicare coverage of palliative care, it's likely that Medicare will pay for all or part of your care, but the level of coverage might be dependent on the Medicare plan that you have and your specific case. So again, there's a lot of nuance. Medicare is very complicated. So just one more time, I'll say, make sure you investigate your specific case, particularly with room and board as well, because room and board can be very, very, very expensive. All right, and to close out the Does Insurance Cover It portion of the long-term care planning series, let's talk about long-term, higher level of assistance and how Medicare and Medicaid might be able to help support you. So the first option that we'll talk about in this long-term, higher level of assistance portion is nursing homes. When it comes to nursing homes, it is likely that Medicaid will cover your stay if you have chosen a facility that accepts Medicaid. So this is where that spend down thing that I've been talking about really comes into play, because not all facilities accept Medicaid or have Medicaid beds. They don't all have that Medicaid contract. It's not a requirement. So if you want to use Medicaid, either from the get-go or later down the line, that's why it's really important to understand whether that facility has Medicaid beds or not. It is also important to note that it is likely that Medicaid will cover your room and board in a nursing home if you meet eligibility requirements. And so again, I want to remind us here about the differences between Medicaid and Medicare. So for Medicaid, you must meet certain income requirements. But again, it is likely that Medicaid, yes, will support you in a nursing home and in paying for a nursing home, so long as that facility has that Medicaid contract. So when it comes to Medicare, which again is for the most part health insurance for people 65 plus, it's unlikely that Medicare will cover the cost of a nursing home, though it may help with the cost of some of the services that you'll need within a nursing home, such as skilled care. So again, this is why it's very important to understand that difference, and why in certain cases it's helpful to be doubly covered by both Medicaid and Medicare. This is also why people in these longer term options will consider a spend down, because, for example, with a nursing home, that room and board is going to be very, very, very expensive, and paying for it out of pocket is quite a hurdle. So if you can get to a spend down, it might help you out, so long as, again, that nursing home has that Medicaid contract. Memory care is for individuals with advanced dementia and Alzheimer's, particularly those who pose a wandering risk. This is often a service that's housed within another type of care facility, like a nursing home or a CCRC, or continuing care retirement community. Now, it is likely that Medicaid will cover the cost of memory care, but again, it might depend on the type of facility. So in a nursing home that provides memory care, it might be more likely that full coverage is provided, but coverage may change depending on the type of facility that memory care is provided in, and again, what their contracts look like with Medicaid. So hopefully, well, not the last time, you'll hear it a couple more times, but just make sure that you understand your specific case and discuss that with a professional. Kind of similar to its coverage for nursing homes, Medicare is unlikely to pay for the room and board of a memory care unit, but depending on your coverage, as well as your needs and specific location and all of those different variables, they may cover some of those services that you or your loved one might need in a memory care unit, particularly those that are medically necessary. So Medicaid and Medicare, just to reiterate, are health insurance programs. They're not designed necessarily to help support with housing, room and board, things like that. So with an assisted living facility, that facility itself may not be considered medically necessary. And as a result, Medicaid is unlikely to cover the cost of room and board in that facility, which makes up a large portion of the cost of being in an assisted living facility. However, it is possible to apply for a Medicaid waiver, which may provide some financial reprieve, and potentially Medicaid would be able to help with some of the services that you receive in that assisted living facility. So if you were here for options and acronyms, you know that I struggled with where to put assisted living on my little matrix, because generally, if you're in assisted living, the expectation is that you can meet the majority of ADLs by yourself, but you might need more help with IADLs, or instrumental activities of daily living. And I'm bringing this up because assisted living is not necessarily thought of as medically necessary, which impacts how health insurance will support you. So like Medicaid, it's unlikely that Medicare will cover most of the costs related to assisted living, because again, that facility is not understood as a situation that is medically necessary. That said, Medicare may be able to help with some of the costs associated with your assisted living facility. So if you are receiving, for example, skilled nursing in an assisted living facility, Medicare may be able to help you out. Boarding care is essentially residential type care provided in a home or a converted home that has a small number of residents, oftentimes less than 10. Boarding care can vary in the level of assistance as well as what's provided, but depending on the facility, it's most similar to either assisted living or a nursing home. And so because there's all of that variation in what it might look like, what it might entail, who is the staff, who's in charge, what services are provided, we're not going to get into the different levels of insurance coverage when it comes to boarding care, since the facilities can be so different. But keep in mind what is, medically necessary. And just remember to make sure you do your research for your specific case, because things might be covered for one particular case that are not covered for another case. And with boarding care, like I said, there's kind of more variation. So make sure that you do your research. And that's a wrap. We have now finished topic 3. So in summary, Medicare and Medicaid are health insurance programs. And generally what that means is they cover things that are considered to be medically necessary. And that doesn't always mean the cost of room and board, depending on the type of facility that you or your loved one is looking into. It is important to take time to investigate your particular needs and situation because, as I mentioned at the beginning, I'm saying things are likely or unlikely to be paid for, but every situation is different and there is a lot of nuance and details related to both of those insurance programs. So making sure that your specific case falls under these categories and meets these requirements is really, really important. Depending on your situation, unfortunately, you may be left with the cost of room and board, which makes up a large portion of cost when it comes to long-term care. So how can you cover these expenses that insurance doesn't cover? I'll give you some ideas next time to help offset these costs.